I'll just go over some of the quick housekeeping for today's webinar. So as you may have noticed, today's webinar will be recorded, and the recording will be emailed shortly after the webinar today. This meeting does have closed captioning, and as you're doing so far already, please continue to put your comments, your feedback, and any questions you have into the chat. We also have the question and answer function enabled today, so please feel free to use that. And with the Q&A, we will have a part at the very end of the webinar that will be able to get to some of your questions. So again, put those in the chat or put them in the Q&A, and we'll be sure to get to those either during today's webinar or we'll follow up on them. I'm excited to introduce all of the presenters today. Next slide, please. Awesome. So from Case Western Reserve University School of Medicine, we have Melissa Pflugh Prescott, who is the co-director of the USDA-funded Center for Food Conservation and Waste Reduction, and who is a behavioral nutrition scientist. Melissa's research uses a systems approach to change food behaviors to support healthy eating and planetary health so that people can reach their full health potential. From the University of Illinois, Urbana-Champaign, we have Dr. Matt Stasiewicz, who is an associate professor of applied food safety. He works to help companies, regulators, and consumers make better food safety decisions using statistics, computer modeling, and innovative lab work. The broad goal is to help the food system feed more people without them getting sick. And last but not least, we have Gabby Pinto, who is a PhD-MPH candidate at the University of Illinois Urbana-Champaign as well, who works under Dr. Stasiewicz, where their research group broadly focuses on applied food safety at the intersection of food security. Gabby's research evaluates the impact of different food safety practices across food systems to drive risk-based decision-making for industry and public health. I'm super excited to pass this over to Dr. Prescott, who's going to kick off our presentation today. But before I begin, I just wanted to do an amazing shout out and say thank you for joining us today again. This webinar is brought to you in collaboration with the Multiscale Recipes Wasted Food Research Network, the USDA, the Case Western Reserve University, and the University of Illinois of Urbana-Champaign. If you would like to learn more, please visit recipes at wastedfood.american.edu and follow them on Instagram, Blue Sky, and LinkedIn at Wasted Food Network. Awesome. Now over to you, Melissa. Thanks so much.
Thanks, Mary Jane. Really appreciate that great introduction. So let's start by discussing the relevant social problems addressed by share tables. There are millions of food insecure Americans, including 13 million kids. At the same time, we know that diet is the top modifiable risk factor for preventing risk of chronic disease. And luckily, school nutrition programs address both of these concerns. They provide healthy food for free or low cost to 30 million kids a year, and the food served in school nutrition programs is healthier than what is provided in packed lunches, and it is often the only consistent access point that some children have to fruits and vegetables. But like any parent can tell you, kids waste a lot of food. You know, and school meal programs not only have the tricky job of serving the most difficult clientele in town, but they have other barriers like short lunch periods that make food more likely to be wasted. So given the huge scale of school nutrition programs, this results in school meals being significant contributors to environmental degradation. From the public health side, we know that food waste concerns have also prompted rollbacks of some important nutrition standards. So together, these planetary and public health concerns underscore the need for effective strategies to reduce wasted food without undermining public health. I don't have time to discuss it today, but in the past, we've investigated the feasibility of many different school food recovery methods, and share tables are the most feasible strategy. Next slide, please. And so what is a share table? They're basically places in the cafeteria where students can take items from their from the lunch they get at school, but they have to be unopened and uneaten. And they can place them on the share table, and that gives other students the opportunity to have a second helping, or even packed lunch students a chance to eat some of these foods. The two main goals are to recover wasted food and to promote food and nutrition security. So on this slide, we have some of the policy memos provided by the USDA, and I'm going to give you the highlights here. So one of the big things to know is that share tables are not supposed to be your first line of defense in terms of waste reduction. They are supposed to complement other initiatives to reduce waste in the school nutrition program. So if you want to know about more of those, feel free to ask in the Q&A. Second, it's important to know that the USDA does allow foods that are placed on the share table to count towards multiple reimbursable meals. So if one student goes through the line, puts an apple on the share table, then the next day that same apple could be served in a second reimbursable meal in a future lunch period. And then one of the most important things to know is that the USDA requires that share tables do not violate local and state health codes. So food safety is such an integral part of share table operation. Next slide. So let's get a pulse on what you all think. If Rachel, you can launch the poll. We're going to do a quick poll, and we want to know what you think. Should your kids' school or maybe the schools in your community allow share tables? So I'll give a moment or two for people to respond. And I'll let Rachel decide when she wants to close the poll. All right. So it looks like we got a lot of people in favor. I thought that might be the case since that might have motivated your attention today. But thanks for letting us know how you feel. So since share tables need to be aligned with local health codes, the USDA recommends that share table plans be approved by local health departments. So to learn more about what health departments are looking for when reviewing share table plans and conducting their health inspections, we did a qualitative study where we interviewed health inspectors. And we also asked them to identify the major risks of foodborne illness stemming from share table operation. And so the things we learned is that health departments are really looking to work collaboratively with school nutrition programs. They really want to have as much communication as possible to figure out how to make the share table feasible and safe. They really prioritize having any staff that are going to be monitoring the share table or who are going to be handling the food that's left over at the end of the day, be trained about share table operations, and to be sure that training included allergen training. But the thing that really surprised me from this study is that we learned that unanimously all of the people in our study agreed that fruits with an edible skin like apples and pears were the biggest concern for foodborne illness. I had assumed that it was going to be something to do with the temperature abuse of the milk, like keeping it cold enough, but it wasn't. The main health concern is student hand-to-hand contamination of norovirus. Next slides, please. So norovirus is the leading cause of vomiting and diarrhea from acute gastroenteritis among people of all ages in the United States. It makes up the majority of all foodborne illness cases. It usually peaks in the wintertime from November to April, and it's spread through sick people and contaminated surfaces. But even though it can be really uncomfortable, the GI distress that comes with norovirus, the good thing is that it's not life-threatening for most of the human lifespan. However, schools are a common place for norovirus outbreaks, and it's been this way long before share tables became a common practice. And that's probably because kids have a knack for, I don't know, touching like everything they walk past. It never ceases to amaze me how the need that kids feel to put their hands on everything. They touch each other throughout the day, they share lip gloss, and they even share food outside of share tables. So the risk of norovirus transmission is real with or without share tables. Next slide, please. With that in mind, let's switch gears to implementation. So there are multiple share table types that you can choose for your school. Traditionally, schools operate on a share and take share table, which means that students are freely able to both place items on the share table and take them off without any restrictions. And so this works best for fruits with inedible peels like bananas more so than apples. Alternatively, you can have a share-only share table where you're just basically collecting unwanted foods from kids and then not making those foods available to be taken during the same lunch period. Or you can have a hybrid where maybe you have some things that can be share and take, but others like, fruits that need to be washed, who are only share only. So another difference in share table implementation is how you're utilizing TCS foods. Those are just foods that are time or temperature controlled for safety. So those would be your cold items like milk and yogurt. So the USDA allows 3 different options for how to use food that is placed on the share table. Most commonly, it's eaten during the meal period by students. It can also be donated to nonprofits that are off campus, such as a food pantry, or maybe you might have a community backpack program that might send foods home with children. It can also be reserviced. So this essentially is like what I was referring to earlier, when you're using the same food item in multiple meal services as a reimbursable meal. Next slide, please. So to assess and pilot share table implementation using best practices for food safety, we conducted a pilot study with SNAP Ed programs in 6 Midwestern states using a train the trainer intervention where our research team trained SNAP Ed staff, and then those SNAP Ed staff trained school nutrition program staff and provided technical assistance. In particular, they helped talk with local health departments to get share table plans approved. Next slide. So what we wanted to know was, what is the average rate of food recovery in a train the trainer approach to pilot share tables? We had 41 participating schools with over 16,000 students. Next slide. So to be eligible, since we were working with SNAP Ed, we were exclusively working with schools that had high eligibility of free and reduced price meals. And the schools had to be willing to share cost data each month for all items that were eligible to be on the share table, and had to allow the SNAP Ed staff to come in every other month to observe the share table use and have their staff fill out surveys about feasibility and satisfaction. So as a reward for participating, we either purchased a share table kit, which is pictured there, and it had basically all you need to implement a share table. Alternatively, we gave them a check. This was at like a peak time in terms of shipping costs and everything being more expensive after lockdown. And so now you can get all of this stuff for cheaper than what it was at the time. Next slide. So we use the data collected during our meal observations to calculate the per school day predicted means and multiply this by the minimum legal number of school days required in each state. And we concluded that on average, each school recovered over 1 ton of food in the first year of share table operation alone. We feel like this is an estimate of the food recovery floor for share tables, because usually in the first year of operation, things are slow to start, but as staff and students get more accustomed, the share table becomes more effective at recovering food. Also, these estimates are not likely generalizable to more affluent school districts. We suspect that rates of share table food placement might be higher in areas with less child hunger. Next slide. We also tracked how the food placed on the share table was used. And as you can see, the majority of the foods were taken during the same meal period by other students. We also had a significant amount being reserviced, but donation was less common. And we did have about 6% of the recovered food be landfilled. This was because of state and local health department rules about what could be done with leftover items on the share tables. Next slide. So in terms of food costs recovered, we estimate that of that basically 1 ton of food that would be recovered over the course of a year, that food was cost school nutrition programs about $2,600. So this wouldn't be the market value of the food, since school nutrition programs have food that's subsidized by the government. But one thing to note is only 20% of the food that was recovered was reserviced. So even with such a small fraction doing that, there was still an average of $624 being a food cost reduction by the schools that did do reservice. And so we anticipate, again, that reservice would probably be a more of a default option for schools that have lower rates of child hunger. So now that you can see the benefits of share table operation, let's switch gears and Gabby will lead our discussion about how to keep share tables safe.
Yeah, great. Thank you, Dr. Prescott. So hello, everyone. I'm Gabby. I'm going to take you through some of the work we did on the food and microbiology side for understanding some of these concerns that came from health inspectors about share tables. So we're going to focus on items like apples and milk. So we'll take you through the studies that we did to study food safety of apples and food quality and food safety of milk on share tables. So first, I think it's important to point out, how can we shift the discussion? So if we're talking in a way where we're thinking of hazard-based thinking, an advocate might say, you know, kids share food all the time. Dr. Prescott mentioned kids share lip gloss. Kids always touch each other. No problem. So why can't we just share food? However, because of this different rules that might exist at the local or state level, or just because someone might be adopting the FDA food code, a critic could say that sharing is risky, so no, because of certain reasons. Maybe it's a time temperature controlled for safety food. Maybe it's a fruit with an edible peel. So in that case, if we're just in our hazard-based thinking, we might maintain status quo and there's less food recovery. So in the bottom left corner, we have a little quote bubble from that study that was done with health inspectors. And this is just a quote from one of them, talking about how milk per their local health code must be stored at 41 degrees Fahrenheit or colder for it to still be considered safe. But if we start to shift this thinking towards risk-based thinking, maybe we can start to make progress, and we'll kind of talk through how we can make that progress. So we already accept these risks, right? Kids share stuff, kids touch each other, and kids have to eat. And we accept risks in schools more generally. In the top right corner, we have another quote from a health inspector that, you know, kids do all kinds of stuff on the playground and they hug each other in the classroom and. But given that we accept these risks, other risks in schools, can we start to shift this conversation to understand if sharing actually meaningfully increases the risk compared to not sharing food items? And how can we weigh that against the benefits? And if there are any additional risks, can we manage these? And because every school might be different in terms of their meal service length, in terms of just different parameters about their school cafeteria, can we still manage these risks given those different conditions? So first, let's think about how we can proceed with our models. So maybe this is going to look a little chaotic, but this is just kind of a representation of different share tables. These are pictures from actual schools across the United States. And what I'm hoping you see through looking at all of these pictures is that there are a lot of different ways that share tables can be. There are a lot of different pictures here that represent share tables, and that could be due to maybe local code, maybe because of how they decide to set up their share table program. In the bottom left corner, you can see that there's a share fridge. Sometimes there's carts, sometimes there's baskets, sometimes there's trays with ice for milk or coolers. So there's just a lot of variation. And when we actually investigated this in Dr. Prescott's previous work, what she found is that nearly 50% of the states had no share table policy documents, so maybe no local or state level code. But where one does exist, because there might be variability in share tables, or there might not be code, and so maybe FDA food codes followed, maybe a variance is required. And here's just another example illustrating these concepts that I'm talking about, that there are sometimes inconsistencies in the items that can be shared just depending on this. So in the left-hand picture, we can see that milk cartons are not eligible to be shared, but in the right-hand picture from a different state, we see that milk cartons may be shared. Now, this doesn't communicate maybe the nuance of local health code, but you can just see that there's variability about what share table policies are implemented in different places. So if we come back to this slide and we shift the discussion to maybe towards risk-based thinking, how can we use models to kind of answer these questions around risk and address these questions of whether or not share tables will increase the risk, and can we manage those for particularly microbiologically sensitive food items? So first, just going through the risks related to apples, our goal was to provide evidence-based information to include apples in share tables. We wanted to answer questions like how risky are apples, how much riskier are shared apples, and how can we manage that increased risk. So you'll hear me talk about these three kinds of themes as I go through the work that we completed, and this work was published in Microbial Risk Analysis, which is a journal, a scientific journal. So in this case, our modeling solution was to do a quantitative microbial risk assessment of norovirus in apples. So the process model simulates students selecting apples from a cafeteria service line, and then they can choose to consume, discard, or share that. In a traditional cafeteria system, the kid would just select the item, sit down, consume it, or discard it. When we implement a share table, there's this extra step of the share table where then again, they can either choose to select that item, consume, discard it, and then they go back to sit down at the table. Where risk modeling comes into this is we want to understand in this additional practices from adding a share table, what happens to norovirus particles that we might assume are on the apples or on students' hands that get transferred to the apples rather. And then we can evaluate the effect of share table on what we are studying as the final illness prevalence among students, and I'll talk about what that means in the next slide. So what we found through this work is that share tables modestly increase food safety risks. So when you add a share table, the average illness prevalence that we observed, which illness prevalence means the number of sick students divided by the total number of students at risk for that illness. What we found is that it increases 6.8% from 1.5% to 1.6%. So to break that down a little bit more, in a traditional cafeteria, we make in our model some assumptions about how children interact with items without a share table being there, and assuming that they have some contamination of norovirus particles on their hands. Then the baseline system, the traditional cafeteria, the mean illness prevalence is 1.5%. When we add the share table, that increases to 1.6%. So that 6.8 increase is in this bottom table. Hopefully you can see my mouse kind of going around it. And so that asks the question then, how can we manage this additional risk that's added by share tables? Because while modest, it is still an increase. And what we did is a what-if scenario analysis, and what our takeaways are from these. In this first table, what you can see is we implemented hand washing station before the service line, a hand sanitizer station before the service line. And when we set these healthy environmental practices like hand sanitizing and hand washing, what we see is a reduction in the illness prevalence, even from a traditional cafeteria, which wouldn't have those practices in place. We could also do something like a share-only share table. If you go to the paper for this, it will say one-way share table. The language has been shifted to share only in our toolkit, so that you'll see that reflected in this presentation. But that would allow practically a cafeteria personnel to take those apples, wash them, before they could be accessed by a student again, instead of allowing kids to grab and take apples, which have that edible skin that might have be riskier for norovirus particles to be transferred to. And so you might turn this on at different points in the year, or maybe just depending on what's going on. Dr. Prescott mentioned that norovirus peaks and valleys at different points in the year. So maybe in those months where you're expecting norovirus illness prevalence to be higher, then maybe we switch to share-only shared table, or maybe we do hybrid. So for items like apples, then we only do share only for those, but maybe for foods like packaged crackers, we allow those to still be shared and accessed within the same meal service. And so in summary, you can kind of see that there are different strategies we can take in order to manage that modest increase in food safety risk from adding shared tables into a cafeteria system. And so that was our work on norovirus and apples. And now I'm going to shift gears to talk about the studies that we did regarding food quality and safety for milk and how we can manage the risks related to milk. So our goal was to provide evidence-based information to include milk and share tables, and in this case, answering questions like, would adding share tables cause premature milk spoilage, or would it allow pathogens to grow to unsafe levels, and also start to look at what's the residence time of milk in a system? How long do we actually expect kids to access? I'm sorry, I just saw something pop up on my screen. I'm not sure if you can see that in the center, but how long milk will typically be in a cafeteria system with a shared table, and how likely would a student be to receive a spoiled milk carton? So just to put the bottom line up front with our key findings, what we found through our various studies, some were lab-based and then connected to some of our modeling work, that main drivers of milk spoilage are overnight refrigeration temperature and initial milk quality. We also found that based on sharing dynamics, that spoilage is very rare, listeriosis is very rare, and there was a modest increase in spoilage and safety risk for schools where we assume longer bell schedules, so maybe longer lengths of meal services throughout the day, but this increased risk is largely manageable with improved storage. So I'm going to take you through a visualization of some of the lab data that we generated, which then informed our understanding of how microbial spoilage bacteria would grow in milk in our simulation work. So what we did is we grew a very, very fast growing spoilage bacteria. So we chose one that we knew would grow very well in milk, maybe even more so amongst other spoilage bacteria, so that we could kind of have this worst case scenario. So what happens when we put spoilage bacteria in milk, we stick it in the fridge, and then what happens when we put spoilage bacteria in milk, again, at a reasonable level that we might expect to be in the milk, and then we take it out for 2 hours a day. So in this case, in this lab-based work, to represent a share table that was worst case, we took milk cartons out of the fridge for 2 hours and 5 minutes or 125 minutes per day, and we didn't expose it to temperature control, then put those back in the fridge. And so this is just kind of showing you what happened graphically. So as the days went on, spoilage bacteria continued to increase for both milks, which in the blue dots are milk cartons that stayed in the fridge, and for the yellow dots, which are milk cartons that went on the hypothetical shared table each day. So I'm hoping what you notice through this visualization is that at some point, milk's still going to spoil, even if we keep it cold in the fridge for 5 days, and that this happens faster if we keep reservicing milk. And it's important to think about, though, when are these changes happening? If we want to know if a share table is driving the increased risk in microbial spoilage of milk, because again, that will eventually happen at some point if it's in the system for 4 or 5 days, assuming those worst case levels that we put in the milk, where is that change occurring? And what we found actually was that overnight refrigeration was driving those changes in spoilage bacteria. So what you see is there was about a 10-fold increase in spoilage bacteria during that overnight refrigeration period, which is just shy of 22 hours in this case. But on the share table, what we observed by taking samples of the milk at the beginning and the end is that only about a quarter of that increase that we were observing in overnight refrigeration was what we were observing on the share table, which again comes back to this point that spoilage is mostly caused by the overnight storage of the milk in the fridge, not because we're putting milk on the share table. But it's important that we still observe low quality milk would spoil after 3 days. So isn't that a problem? But what we see is that we need to incorporate the behavior from the how students might interact with items from a service line or on a shared table in an actual cafeteria. So what we do is we kind of grab those dynamics from that first norovirus in apples model and we adapt that to milk cartons. And we make those same assumptions about how students interact with those items to now with milk items. And we assume those same participation rates, etc. And if you're interested in model details, we do have screenshots of the titles of the paper, and I'm happy to share those with you during the Q&A or after this call. This is a modeling question. So are milks likely to be reserviced after 3 days in a cafeteria? And what we found is that most milk that's consumed is not, first, it's not contaminated with a large amount of spoilage bacteria, but a few are. And when this matters is if these milks that might have an initially higher contamination of spoilage bacteria end up staying in the system for more than a few days. But what we find is that this is very rare. So if you look at these 4 green points up here, these are the ones that exceeded a quality threshold, which is what we use to determine spoilage. And importantly, it was very rare. But it's also reasonable that you'd still be worried, because how could we also use models to understand if we store milks better during the shared table service? Like I mentioned, that experiment was just taking milk out of the fridge, placing it at room temperature each day. But if you think back to those pictures that I showed at the beginning, sometimes there were coolers with ice, sometimes there were steam table trays with ice. There was a lot of variation in how items like milk that are time temperature controlled for safety might be presented on a shared table or stored. And so if we look at temperature in a cooler or temperature on ice, if we think about different meal service lengths, maybe your total meal services for a day are only about 40 minutes. Maybe for another school, it's like more than 4 hours. And so we started to ask the question, does any of that matter? And so building upon the adapted model for milk sharing, we first collected some empirical data to start to inform these new temperature profiles. So I don't have the picture shown here, but I'm happy to show it after of just the different ways that we collected data about milk that might be stored in a cooler, milk that might be stored in a refrigerated steam table tray. We looked at a few different conditions, and then we used that information to predict temperature changes in milk by building this heat transfer model. So for these different scenarios, we get different milk temperature profiles for each shared table storage system, for maybe cooler or warmer cafeteria temperatures. And in total, we have 25 scenarios representing 25 different temperature profiles. Now we take that information, put it back into our process model that we adapted again for milk in cafeteria, and we see how these changes to the temperature profiles matter or not, and that helps us get to risk. How likely is it that a student would receive that receive a spoiled milk carton when we account for student behavior, when we account for these different conditions? And what we find is in that baseline share table system, in this case representing what we did in the laboratory, which was 125 minutes with no temperature control, that the range of milks that will spoil is small, but there are still some. It's from 0 to 1. And the milk peak temperature is around 65 degrees Fahrenheit. And our control in a traditional cafeteria or a cafeteria with no share table, we see that the range of spoiled milk cartons is 0. But then when we start to layer better temperature control, so we're using those different temperature profiles during the 125 minutes of a share table, what we see is that there's modest decreases or sometimes even meaningful decreases in the milk peak temperature, and that the range of spoiled milks doesn't necessarily change, but we can keep milk colder. So maybe that matters, maybe it doesn't. Then when we look at different temperatures of cafeterias, we also see modest decreases, in one case increase because it was a warmer temperature than our baseline system in milk peak temperature. But again, that might not matter because that range of spoiled milks that we're observing is still the same. Where it starts to matter is when we have poor overnight refrigeration. Now, admittedly, that might not actually represent anybody's refrigeration system here. This is a worst case because I know that There's a lot of temperature logging that's done and there's systems for that, but we start to see these increases when that overnight stretch of temperature is worse. And remember, in the previous study, what I showed is that overnight refrigeration really mattered. And then when we go and look at Bell schedules, we see for these very, very long or very long meal services, so somewhere between 3 and about 4.5 hours, that range of spoiled milk cartons does increase, but it's still rare. But again, when we see these increases in risk, we ask the question, can we manage it? And what we find is that when we implement trays with ice or ice packs during these very long meal services or long meal services, that we're able to reduce the increase in risk by about half. So that's milk quality, which is important because that also came up in these discussions with health inspectors. But it's also important to ask questions about safety. So quality is manageable, great, is the milk safe? So now we take that model that we previously made for spoilage bacteria, we adapted to a pathogen, Listeria monocytogenes, which you may have heard of. This pathogen is very, very rarely found in pasteurized milk. In fact, you might be asking yourself why we would investigate this question, knowing that Listeria is a zero tolerance organism in ready-to-eat foods like milk. But we need a way to assess safety in milk, and we need some metrics to understand that. So we choose Listeria monocytogenes because it is very, very good at growing in low temperatures if it's there, amongst other pathogens that we might have heard of in sources more like raw milk. And so we use relevant parameters that we adapt for this pathogen. We modeled the same types of scenarios as the range of scenarios in the spoilage model, and then we predict safety-related outputs. So what we found is that most milks were consumed before a 1 log 10 or a 10-fold increase of pathogen growth, and actually less than 1% of the milks in the system, because of that sharing behavior of students, even had a greater than 1 log of growth or 10-fold increase in growth, even when we consider no temperature control during a cafeteria service. And what we also see is that when we implement reasonable cold storage, that we are able to reduce the percent of milk that actually reach that change in the system to less than 0.01%. So you can kind of see that highlighted here. What we also importantly observe is that there's a very small difference between Listeria monocytogenes changes in a traditional cafeteria with no share table and a cafeteria with a share table without temperature control. So you might see these black bars here and think that they look far away, but when we consider the scale of the change of Listeria on this y-axis here, we see that it's actually quite small. So again, those changes that are happening to the milk in a traditional cafeteria system versus a system that has a share table are not very different. So we know that maybe if Listeria monocytogenes growth is happening, that it's not necessarily being driven by that short stretch of time on a share table. And importantly, what we find is that listeriosis risk for children across all public schools in the United States is extremely low. So when we consider our output metric of risk, which is probability of listeriosis from consumed milk, and then we look at that across just shy of 100,000 schools that exist in the United States, we don't even observe one predicted illness until 100 years. And that's happening in this very long scenario with no temperature control. When we implement temperature control, we're able to extend that amount of time before we would observe a predicted case of listeriosis. But the main point actually is that usually what we predicted, it would take on the order of 2 millennia before we would observe a listeriosis illness. So again, just communicating that point that listeriosis is very, very rare. That is a lot of information, so I'm happy to answer questions after this. I'm going to switch gears back to Dr. Prescott, and she's going to kind of bring this home with just the summary of this research and also the toolkit materials that we developed. So thank you for your time.
Thanks, Gabby. So, long story short, what we conclude is that share table food safety risks do exist, but they're small and also manageable. And circling back to the first point I made about apples with, in pears being the most risky share table items in terms of foodborne illness, you can see that milk, pasteurized milk is quite safe. And yet in terms of feasibility and like staff time in managing a share table, the bulk of it is spent on milk and keeping it cold. And so I think it's important to keep in mind that we probably need to take the same amount of focus and put that on the apples as well. But we do find from the work in the pilots is that share tables are inexpensive to maintain. I didn't have time to go through that, but there's very little costs after you have your initial share table set up. However, share tables do provide a significant reduction in landfilled food. Next slide, please. So we can revisit the poll really quick. Hopefully we didn't discourage anyone from thinking there should be a share table. I don't know if you want to do the poll again, Rachel, if we can just check in one more time. So yeah, if you can do your one last vote. I'm going to assume we still, okay, yeah, we didn't unconvince anyone. We still have a few people that are unsure though. So we'd love to hear those questions from especially the unsure folks during the Q&A. Next slide, please. So let's talk more about how you can use this information at your school. So first, be ready to talk to health departments. In particular, be ready to share how your school is training the staff that engage with the share table or monitor it. Be ready to have standard operating procedures, which, spoiler, we have all of those in the toolkit that I'm about to share. But make sure you're ready to talk about how to mitigate norovirus risk. As Gabby mentioned, you really need to do the hand hygiene before people get in line for food. And so if the only opportunity for hand hygiene is a bottle of hand sanitizer on the share table, you're really not, it's really not taking enough action to mitigate norovirus risk because it's already on the foods then that get placed on the share table. But the big picture thing to keep in mind here is that some local and state health codes may be overly conservative. These findings about the actual risk show that the small risk to public health in terms of norovirus and other foodborne illness is small and easily managed by some of these strategies that were shared today. And so we believe that our findings support moving away from hazard-based towards risk-based approaches to food safety. So just because there is a chance of listeriosis occurring once in 100 years, does that mean that share tables should not be allowed to collect milk or to reservice milk? Because that is what happened during our pilot. Not all schools were allowed to even have milk be put on the share table due to concerns by the health department. Next slide. So when you are implementing a share table, the top 3 things that, in my view, in terms of abiding by policy and our research implications, is you should be operating a share table at the same time as other steps to prevent food waste. Taking student hand hygiene, really promoting making sure that students have clean hands before they get in the service line, as well as training your staff appropriately. Next slide. So here's the link to the toolkit. This toolkit was a distillation of the research that you just heard about, as well as some of the things we didn't have time to talk about, and it was led by University of Illinois Extension. So it has the standard operating procedures, it has links to free trainings for school nutrition staff, and it has training programs for students, how to get students ready to use share tables. It also has tips for working with health departments, as well as these research summaries and other communication templates to get word out to parents and other members of the school community. Next slide. So really quickly, we have to acknowledge our funding from the USDA, as well as the students and collaborators who made this possible: Gustavo Reyes, Jessica Kasalki, Gwen Balto, Yi Lee, Ben Peterson, and Paola Correa, as well as Trinity Allison, Leah Fleury, and Stephanie Pike Moore. Next slide. And lastly, really need to acknowledge our main community partners, 7 Generations Ahead, as well as Illinois Extension, Michigan State Extension, Ohio State Extension, Purdue Extension, Minnesota Extension, and Wisconsin Extension, as well as the 41 schools who collaborated with us. And with that, I will turn it back over to Mary Jane. Thanks, everyone.
Wow, thank you so much, Dr. Prescott and Gabby. That was an incredible presentation, and huge round of applause to completing this research and putting together this really comprehensive toolkit. I know that the level of comfort that I feel, and after seeing all of the research you did on the food safety and compliance, is really incredible. And I know that as a strong promoter of share tables, and knowing that share tables are so active just across the US, this has been such an informative and comprehensive webinar. So yes, thank you so much again. I'm excited to dive into the Q&A part of today's webinar as well. We've had some really incredible questions coming through the chat. And I just wanted to kick it off. I know that there was some interest. And Gabby, you were able to touch a little bit on kind of what those most common food safety violations seen within share tables might be, or at least the most kind of common questions that come up between apples and milk. And you brought up a point on like low quality milk, making some variations within that. And one of the questions that came up was about how schools, when schools provide shelf stable milk, how do you kind of avoid concern about spoilage, and maybe what are some of the topics that come with that? And would love to pass it over to Gabby and Dr. Stasiewicz to help kind of provide an answer to that first.
Yeah, Dr. S, you might want to start because you just answered this question in a different meeting, and I think you had some interesting conversation.
Yeah, no, I want to bring this one up. So yeah, for better or worse, I was talking about this last week to the Illinois. It was a group that was historically our food safety community, but so they had a lot of people that were dairy processors, but also folks who were health inspectors, school nutrition people, even some folks who were like health inspectors who'd worked with their districts to get share tables in schools, which was great. And one of the things that came up is one of the guys said, why don't we offer shelf stable milk on share tables? It would essentially, we're solving the wrong problem. Why don't we just do that? That's a technical solution. And interestingly, there was a guy in the room who was from a large milk co-op in Illinois who said, well, we do make that and we do send that to some schools, but there's a bit of a trade-off because it costs a little bit more and the kids don't like it as much. So it's less ideal. They said what they tend to use it for is schools that are really hard to get to. And so in my brain, I'm imagining maybe some fairly remote schools, or maybe schools that don't have as much ability to do their own temperature control. And then this is a management strategy, but it would probably be driven more for what's the main milk your school can provide to children, not so much what you would do to recover it. So those were just some sort of thoughts, and it was cool to hear a processor talk about that and how they viewed that as well. So.
Yeah, absolutely. And thank you for kind of sharing that anecdote. And yeah, it's funny because you can see how often that question maybe comes up as well when it comes to talking about milk on share tables. Another question that came through the chat is, can you please recommend the most effective way to maybe kickstart a share table, and also how to initially get that buy-in from administrative staff and the kitchen? And initially, I'm going to kick this over to you, Dr. Prescott, because I know you've done a lot of work in this area. So would love to hear your insights on that.
Sure, and probably Mary Jane might have some insights to share on that as well. But one of the main benefits of a share table, at least from what we hear from the school nutrition staff perspective, is that it reduces the number of kids who come through the line asking for seconds, because students do that. And by law, the USDA, you're not supposed to give out second helpings. But by having food on the share table, it gives some agency to students to address their own, food insecurity and hunger. And in terms of administration, in my experience, most of the time, if you could convince the district school nutrition administrator, that's the person that you have to convince. But in terms of the principals or other administrators, there is the potential that, we showed, especially if you use reservice, that you can reduce food costs for your cafeteria. And in terms of getting staff buy-in, with the custodians, I saw someone put that in the chat. Share tables can actually help reduce the amount of food waste that goes in the trash can. So making those garbage cans lighter, so making those trips to the dumpster at least not as either a little bit less frequent or as less heavy. It also can be a great source of food to give any leftover share table food to the nurses station, so that, there's not having to spend money to buy foods to give to students that come to the clinic ill. And the school nutrition staff, my experience is that if you teach them the why and how important their job is in accomplishing it, it goes much better than if you just tell them what to do and, finding out what their concerns are. And we do have surveys that are in the toolkit that you could administer to your staff to find out what their reservations are, and then, work together to try and address those ahead of when you actually do the implementation.
Awesome. That was super great. And I think it also kind of ties back into how do you engage with your local health department, because I know that's kind of another really big common issue and player a part of the share tables and getting them approved for implementation. I'm curious, Gabby and Dr. S, if you have any insight too on what you've seen from your side of this work on how might be the best way to get that buy-in and implement a share table on the ground.
I don't personally have anything to add from what Dr. Prescott already shared. Our involvement in understanding how to get share tables implemented practically was through adding our materials and articulating our materials we presented here in the toolkit. So I would just plug the toolkit and all of the great resources that come along with that. I'm not sure, Dr. S, if you have anything to add.
No, for better, for better or worse, this was a cool division of labor project, and so our group didn't do a lot of the implementation. But maybe part of it is we tried to make our science flexible enough so that it would address a lot of concerns, and we were frequently talking to Melissa's team and making sure that we expanded the scope of our work so it met the needs. Which is also something that I think is really relevant, getting these kind of groups together, right? I think it's relatively rare to have, maybe a modeling scientist on a project like this that's trying to have social action. But I think, when we all want to make the food system better, that's where you can get some nice combinations. So hopefully we can do more stuff like this.
Yeah, I love that, and always want to plug the toolkit because I think what your team put together is really, really incredible, and having the model SOPs, the standard operating procedures, to help encourage share table implementation even more widespread is really amazing work. I know we wanted to close out just a few minutes early, or give enough time to just kind of share enough resources. The last question that I think kind of came through is really is for Dr. Prescott as well. In the beginning, you shared that there are other USDA food waste reduction methods, and if you have any resources that you'd like to point to, or just kind of share more broadly here that you would recommend in addition to share tables.
Sure. So in the toolkit, we do talk about some strategies to reduce food waste, outside of share tables. And so one of the most important things you can do is advocate for longer lunch periods. I know that's easier said than done, but I think that's important to always have going on in the periphery. But serving sliced fruits and vegetables instead of whole is really important. There's, in terms of like simple ways to reduce food waste, that has some of the most compelling evidence of that it works. And anything you can do to keep your lunch line shorter. Again, that goes back to making as much time as possible for students to sit down and eat. And so the less they're spent in line, the more they have to eat. And research shows that when they have more time to eat, they do waste less. So those are some of the strategies that have the most evidence behind them. But then there's also things like getting student input on the menu, doing some taste tests, and increasing that dialogue between the school nutrition staff and the students so that people, students have their expectations in check in terms of what is possible in a school nutrition environment, and that, of course, the school nutrition program gets that important feedback from students.
Awesome. That was super great. Thank you so much. Well, I know that we're kind of running up on time here, and just wanted to share one more thank you and congratulations to the whole team that presented today and the development of the Share Table Toolkit. I know that it was shared in the chat as well, but when we share out the webinar recording in just 1 to 2 days, we'll also follow up with the Share Table Toolkit so you can access it there as well. Thank you everyone for joining today, and hope you have a great rest of your week, and happy International Day of Food Loss and Waste.